Tonight, we will have our very own Kelly from Health and Jody from Urban. And their crews are going to be giving us a report from each of their departments. We had earlier our friend Verlin Nicotine from Red Pheasant. He said our prayer for us tonight. First time I met him, he's one of our new cultural guys. And thank you very much once again to Bobby and Nolan and Roberta and Linda. Give them a great big round of applause. Okay, go ahead.
Good evening. Ooh, blinded myself as soon as I said good evening. Good evening, everyone. Thank you for coming this evening. I bid you all a warm welcome and a hug and a handshake from a distance today. I am just recovering from a flu and I think I'm pretty much over it, but I just don't want to take the chance. Also, I have been testing every day and it's negative. So that's just I guess all of us think we're immune from things, and then all of a sudden it just has us flat on our back. And that's a sign of the snow coming and then leaving and then coming back. And the fact that we still do have COVID out there, and that we all have to still wash our hands and practice social distancing, wear our masks when we need to, as well as I say this, stay home when you're sick. How ironic, right? So as Terrence had mentioned, we're number 8 of 12. So that's 2/3 of the way. Let's give a great big hand to all of our staff that have assisted us, as well as our council that have been doing an incredible job. And mostly, and most importantly, is all of us as membership that are coming together to have these talks and to share our dreams, our aspirations, our frustrations some of the time. It's all good. At the end of the day, it's all good what we have to share. Oftentimes it's just the way we deliver the message that we just have to be a little bit cognizant and respectful with each other. But other than that, everything, every opinion matters and every opinion counts, because it's only by us hearing all of this that we're going to get better together. And we're only going to be able to, as a governance team, as well as operationally with our executive director, that we're going to be able to move towards better integration of services, as well as more effective services, programs and services, whether you live on or off the reserve. Like we've been saying for the last 7, is that it's really important, period, and it's very important to our council to have communication with membership, so that we can have a radar on, not only informing what we've been doing, but also guiding us into year 2. So that's very important to us. But secondly, it's really important to us to hear from everyone, because at the end of the day, it's mostly the chief, but also council members that receive the call for programs, if programs and services aren't being delivered in a way that our membership expects and deserves. So we know that we have some really great things happening, some amazing staff that have the greatest hearts and are so dedicated to their jobs and do the best that they can. We also know that we're underfunded in areas, especially those areas that really make a difference in people's lives. And not only underfunded, but sometimes unfunded in innovative programming that we would like to do. Tonight, we're going to hear from our off-reserve team or urban team, whatever you want to call them. And they do amazing, amazing things with very little money and completely unfunded other than own source revenue. So as we've been listening and learning all together in the last 7, and tonight's number 8, and on May the 4th, it'll be 12 sessions that we've listened and learned together. what we're really going, what we're really looking at, like I was just, before I digressed, was not only are we looking at and sharing what we've done in the past and what we're looking at for year 2, but also the very important aspect of preparing for the conclusion of the 1907. We know that it's this close and we're just at the closing line for that. Is that what it's called? Closing finish line. That's what you could tell I've never run a race, eh? just the biggest nerd chief ever. You know those things that you jump over. And so what we're looking at as we look at the future, and we hope with the wealth creation and the wealth management that we bring in, that will be brought in, there's going to be a drawdown of interest. And with that interest, there's going to be several options for us to be able to, as a community, as a nation, as your governance team, as operations, have for the first time opportunity for programs and services that we have never had before. And unless we have sessions like tonight and we continue to have sessions, we won't be prepared for that. We will not be prepared for those innovative, responsive services for both on as well as off reserve that are required for the well-being of our people. So we really feel that it's more than just listening and learning for the sake of listening and learning here. It's how all of the information that we have, and believe me, we always have at least 2 people taking notes in every session. We put them all together and we will be compiling this as data and baseline data for the future, for as we look at areas within those, not only the inherent rights that we were all born with, but also the treaty rights and responsibilities that we have. So I guess that's my spiel for tonight. And at this time, I'm going to ask for our counselors responsible for this area, as well as our committee members, to please come and sit up front. Not all at once now. Corey, can you put them up, please? Counselors Joshua, Brandon, Allison. And for our Health and Wellbeing Committee, Deanna, Stan, Ronnalee, and Eunice. And just an FYI, we're still super excited to get in those applications for youth and to have youth part of our committee. Okay, before we get to that, Corey, could we go to the next slide? So once again, our goal from conception until we become an ancestor is Mio Pamatsuin, And we acknowledge that we come from our ancestors. They still live within us. Not only does their blood flow through our veins, but so does their knowledge. And it's up to us to be good stewards of all of this while we are still here. That is why we're doing it. And that is our responsibility, regardless of where we reside as Cowessess members. Next slide, please. For health and well-being. So Cowessess First Nation retains the inherent and sovereign right to ensure health and well-being for our people and future generations. This includes our right to food sovereignty, clean water, clean drinking water, clean air, healthy lands, and healthy animals. These inherent rights include the four aspects: physical, mental, not mental, mental, emotional, and spiritual. Somebody's mental over there. The numbered treaties contain the medicine chest clause, which enshrines our treaty right to health and well-being. This includes access to primary health care, prescription medicine, eye health, mental health, and dental health. Also, what I'd like to mention is that we do have our off-reserve staff here that are doing some amazing programming in and around Regina. And it is only by, first of all, it doesn't matter where we were born, where we live. As Cowessess people, we are born with that, with the inherent rights to, like it says, food sovereignty, clean drinking water, clean air, healthy lands, and healthy animals. Once our ancestors signed treaties, they're allowed for the portability of our treaty rights. So once again, regardless of residency, regardless of where you may call home or where you may reside, you are covered under treaty and you are an equal member of Cowessess First Nation. And that is one of the aspects that we as a council would truly like to and always promote, is that we're looking for equity. Now, as we talked about in previous sessions, there's with the contribution agreements that we have, there are reasons why we cannot provide services to those who are off reserve. And those are tied to contribution agreements according to residency. And that residency is on our home reserve here on Cowessess. Now, when we're talking about the innovation and our reach and our ability to reach more of our members who deserve equal consideration, that we will be looking at how we could utilize the 1907 as well as other wealth creation strategies in order to provide programs and services and opportunity and benefits to those who are off reserve. Next slide, please. As First Nations people, we have always practiced good health and carried healthy values. These values extend to the four aspects of living beings: physical, mental, emotional, and spiritual. We had medicine people who were our forms of medical doctors. Lodge keepers were forms of mental and emotional practitioners, and in all facets of health, spirituality played an important role. This way of life was enshrined in our treaties for us to have for as long as the sun shines, grass grows, and waters flow. Today, we have benefits through the Indian Act that address health needs as well as service delivery models at the provincial level, national level, and band level that are designed to address the health needs of our community. Now, we know that is, once again, underfunded or not funded. And we will never, ever allow for us to stop fighting for our treaty rights. But in the meantime, on our road to true sovereignty, which includes our economic base, we will be looking at how to provide those opportunities as also stewards of the treaties to our membership, so that while we're fighting for the government to fulfill its side of treaty, we in fact will not be suffering and living in that poverty mentality or that physical reality, as well as spiritually and emotionally. Next slide, please. Where we are today. Now, here's the time for introductions. So I'm going to hand over the mic as soon as I clean it off. Or, okay, so Terrence will hand it off to Joshua, and for the counselors and committee members to introduce themselves.
Hello, Councillor Joshua Sagan, on reserve counselor. Yes. Thank you. Oh, thank you for coming out. And am I supposed to read? Oh, sorry.
Just tell us how old you are.
Oh. Okay.
My name is Deanna Lara. I've been on Cowessess, a Cowessess member for going to be 62 years. And I've worked in the health field for most of my life. As a nurse and OR technician.
Good evening, everyone. Thank you, World, for the prayer. My name is Rana Lila Valley, and I'm a member of Cowessess First Nation. I reside on the nation here. I'm a mother, a cookum, an aunt, community member for many years, and I spent many years working in health and also working with children. Thank you.
Hunter, my people, I work, I live right across the band office, and I've health committee for many years, 9 years before. And I look forward to helping and leading you in the best I can in the healthy way. I have 4 children and 3 boys and 1 girl. And welcome, come visit. My house is right across the band office, house 40. Thank you very much.
Hello, everybody. Counselor Brandon Pelche. To make it awkward too.
His old awkward vibe is just on me now. I'm like, oh. So I'll start off and thanks to Creator and acknowledge Creator and acknowledge the prayer in a smudge. Thank you. My name is Counselor Allison Whiteman, and I am on reserve counselor. And I'm grateful to the people who've stepped forward to offer their services to the committee. So just with that, thank you.
Hello, my name is Lisa Markham. I actually just became a member of Cowessess Band in August, and I live here at the lake. So I just really wanted to start becoming more involved in the community. And I thought the health and well-being would suit me well because my career has always been in healthcare, and that's where my interest lies. And I hope that I can contribute and be positive for this community. Thank you.
Next slide, please. So on behalf of all of us, thank you to our committee members for stepping forward and to being the amazing role models that you are for us. So everybody, once again, give our committee a round of applause. So as we were saying that we are actually, well, what we are doing is we're looking at the integration of all of our programs and services for effective and efficient delivery for them, responsive to the needs of our members. And the departments that are responsible or work within what health and well-being is the health department, obviously, Chief Red Bear Children's Lodge, income assistance, urban office, addictions, housing department, sports department, and urban services. And it's at this time that I would like to call Kelly forward to deliver the stats as well as to talk about the health department. And I have.
There you go. There you go. There you go.
Thank you. Thank you, Chief. I knew I asked all my staff to be here for a reason. I'm in the wrong. Sorry. Oh my goodness. I'm not.
of the back of my head. Sorry, guys. Okay, now I feel like all cringy, but I'm gonna do my best and just read from the slides. So I'd like to introduce all of the staff. Of course, there's myself, the director. We have Lyndon Lara. He's our health administrator and membership. If you guys want to give a wave when I say your name. Thank you. We have Glenn Palshay, addictions coordinator. Victoria Pegan, addictions research assistant. Randy Lara, youth outreach coordinator. Angela Fremont, maternal child health coordinator. Marissa Demaray, community dietitian. Gil Lara, Jordan's principal service coordinator. Melissa Thomas, our home care RN, she's on leave right now. We have Catherine Fremont, our home care LPN. Joni McKay, home health aide, she's not able to be here tonight. Marianne Lara, home care support. And we actually have one more. Oh, we have all these. We have one more home care staff. We have Amber Bear, who's on maternity leave right now also. We have Tina Redwood, medical transportation coordinator / health service support worker. Joanne Buckles, community health representative. John Lara Jr., health service support worker. Cheryl Slowski, community social support worker. She couldn't be here tonight. Verlin Nicotine, community cultural support worker. Twyla Cody, receptionist. She wasn't able to be here either. Deneen Sparvier, custodian. Crystal Richter, our community health nurse. And then our mental health therapist, Cal Nugent, Brenda Barter, and Isabel Hansen. So what I did was just share some of the statistics for the month of March, just so you guys can get a snapshot of what we do in the health area. So for home care, we have 48 clients total. We have 38 home visits, 5 client transports, and 18 clients receive foot care. And for the month of March, we only had 1 staff in the office because we had lots of people off sick. So Kat did an amazing job getting those visits done in that month all by herself. Medical transportation, we had 23 clients receive fuel support via PO. 3 clients receive meals and accommodations, and 82 clients receive reimbursements for medical travel. For the addictions program, and this was highlighted last week, I think. But we had again 4 NA meetings. We had 2 newcomers in March. We had 4 Al-Anon meetings, an average 6 to 10 clients a meeting. 3 clients went to detox or treatment, and we also were able to celebrate 2 client birthdays in March. So that was exciting. Youth outreach had 2 youth groups in March. Also, Randy worked on setting up services to support youth regarding suicide prevention, and she completed a large Jordan's Principle application that is going to go to support the capital request that is going to happen eventually. So that was a big job. Mental health therapy, Cowessess receives 45 hours per week of mental health therapy from 3 therapists for youth and adults. They also provide a weekly grief group, and there is mental health emergency support available. We do have one of our therapists that answers her phone whenever somebody in the community needs support, and also will support the peacekeepers if called to. Community health, the community health nurse focuses on child health and immunization, so that keeps her very busy. Right now, there's a global measles outbreak happening, so there's a push to get kids, especially kids, but anybody that needs a booster right now can get a booster. She'll go back and check your records for you if you're interested. What happened was through the pandemic, a lot of kids fell behind because of, like the isolation and the social distancing and things. So now it's like really important to get caught up because the measles spread so fast. She, when she explained it to us, and we put out some things on social media to encourage the community. But if somebody with the measles was in this room, like 95% of everybody, if you didn't have the vaccine, you would catch measles. And another really interesting little tidbit is that the measles can reset your whole immune system, meaning that you can go back 2 years and your immune system could possibly not have any memory of any other viruses that you have caught. So that means you're going to get super, super duper sick. So highly recommended to come in and ask if you're up to date on your vaccines. And also it's recommended to get a booster if you're going to travel internationally. So that includes if you're just going to Minot or something. So that's my vaccination plug. Yeah, and also school immunizations at CCEC. That's a big part of her program as well. Just a couple of things I miss is she does do the sexually transmitted infection and communicable disease program, and that's ongoing throughout the year. So we could switch. Thanks. So the CHR does women's group, had a tuberculosis teaching event at CCEC with the community health nurse, and has started collaborating with Chief Red Bear on Healing Our Nation community events for April. Sorry, I'm not even, that's with Samantha, I believe, and that's part of that whole when the chief talks about like getting out of our silos and working together with different departments and things like that. That's one of those things. Community cultural support has taken 8 students to various sweat ceremonies. 5 students went to a Goose Moon Festival, has been supporting culture, language festival and feast and other cultural activities at CCEC, teaching students about the roles of helpers at feasts, and has also been supporting the Al-Anon group and the men's group, which also there's quite a few young men from CCC that attend that. Our community social support worker, that's a really new position. She's just kind of still getting into her stride, getting to know the community, but she has been co-facilitating the grief group every week. She hosted a bingo and did games for the seniors Easter lunch, and she also provides one-on-one client support through some of the wraparounds that we do for families. And she's also just been working on work plan preparation, as I said, very new, just kind of getting her feet under her. Next one. Yep. So just some other things that I wanted to mention is that Ira spearheaded food security hampers, and we helped out with that and provided a couple of staff for that. So that was really great. Also gave out vouchers to all households to use up some of the COVID money we had to use. We are making good progress with breaking down silos with other departments, including wraparound case management, multi-department work plan that has resulted in, so we spent 2 days with Chief Red Bear. There was health, there was sports, there was income assistance, there was the culture team. We spent 2 days together at the end of February and came up with a 6-month activities plan, which has went out to chief and council. And once Corey has time, we're going to sit down and get that out to the community via social media and other ways. And so it's basically like there's something every day, and multiple departments working together on that. So and also we have the staff, quite a few of the staff members are working really closely with the new culture team, which is Clarice and Bill, to build additional supports and services. And then I just wanted to highlight that we have 4 new.
Kelly,
Yep.
I have a joke for you. No, I'm just kidding. Maybe if you could just mention the medical services that are provided as well, wellness wheel, as well as pediatrician and other health
Thank
professionals
you.
that
Yeah.
come.
Sometimes when I get on when I'm doing stuff, I forget things. But yeah, we do also have Wellness Wheel. They've been coming out twice a month, but we're trying to get it bumped up to 3 times as they have availability. They're really booked up. We have Dr. Robertson, the pediatrician, who comes out basically a half a day a month. We also have the dental therapist who comes to CCEC once a week. Oh, I was like, they're doing sign language to me. The optometrist who's actually here this week, right? We have Dr. Shannon Gattrell at CCC for 3 days. Joanne? Right. Yeah. So Women's Health Clean. We also are supporting community members to go in to have their breast scans done also. I can't think if I'm forgetting anything else. I feel like that's, oh, and Body Talk once a month. It's energetic healing and always booked up. Yeah, so just the new hires, and I kind of mentioned them, was culture support Verlin, community social support Cheryl, home health aid Joni McKay, and home care home support Marianne Larosse. So those are all pretty new. Berlin's been around the longest. So did I forget anything else? Oh, no, sorry, I didn't mention Kohai. There's a few things that's under maternal child health. So we do have, so what I mentioned was we have the dental therapist, but we also have Angela, who goes with another dental therapist and does the varnishes for all the kids who are aged basically 0 to 6 years.
The diabetic initiatives.
Yes. Gosh, we do a lot. We also have, our community dietitian, and she works mainly with diabetes, but also with anybody with chronic conditions. So she provides one-on-one support. She will advocate to people's physicians, do things like that. And she's also working on a type 2 diabetes research project in the community that we've been getting some really good engagement from our youth in. And that's going to actually be starting up bi-monthly youth groups specifically related to type 2 diabetes. What is the date, Marissa? Okay. But this month. Yeah. Lyndon? The wellness wheel is the physicians that come out from Regina, and they give a really good service. They do point of care blood testing. They make referrals to specialists. People are seeming to really enjoy the care that they're getting. They're getting the referrals that they need faster. So I'm really happy with their service. Yeah. Oh, and also our home care nurse, just before she went on leave, she finished taking venipuncture, and Catherine is taking her venipuncture. So they will both be doing in-home blood draws if people need blood work. So that's a new service we've added.
So I just want to also give kudos to Kelly and her team, especially when it comes to those professional services that aren't covered under our contribution agreement. Those services, especially with Wellness Wheel, with the doctors, they it's very creative in how we put together the funding, and we seek the funding to have doctors actually come into our community and provide that primary care service. So we are working on more visits per month as well as additional services, but just the fact that we have them really speaks to the dedication of not only our health team, but also the Wellness Wheel doctors who come out at a fraction of the cost sometimes. And they also carpool all together just to cut down on costs for us. So they're very dedicated with the work that they do, and they cover a lot of patients when they are here.
Yeah. And I think that's the end of my presentation. That's it. Yeah, thanks.
Is there any questions for our panel? Carol?
Kelly, is there any possibility or program that we could utilize for prescription drugs that are not covered for our seniors? A lot of our drugs are not covered, and when they do give us those drugs, they're generic drugs. And there's a community senior that was prescribed pain meds. She came out of the hospital, she was prescribed and couldn't afford the $52. So she went without. So in my opinion, we are abusing or taking, not looking after our seniors. Is there a program or someplace that we could take money out of to assist older people with costs? They're all on fixed incomes, and that additional cost for much needed medication is there. Is there a way we could help them?
I'll just hold this far away. Actually, you know what? You make a really good point, and I have seen that happen numerous times. And I've recently worked with Melissa and gotten permission to start paying for those. And it just in the last, I don't know, few weeks or so that we've started to do that. So I think that that's a really good thing, because we don't want to see people go out without medication that they really need. It's not right.
I just want to speak on the prescriptions. There is an appeal process with non-insured health benefits. It's all working with your doctor, getting those letters from them, and also getting the proof stating that these generic medicines don't work for you and that these other medicines do. So getting all that information, getting support letters from the nurse, the doctor, or whoever the physician is that's providing you the medication, we send that all into non-insured health benefits as proof. And then from there, they review it, assess it, and then there are times that they will approve that medication. So in future use, you won't be paying for it.
Yeah, and that's the thing about it too, is that it is a really long process, and it can be really overwhelming, especially for older people. And so if that's a choice that somebody decides to make to go that route, Tina is there to help advocate and assist, and our home care staff through that process. Oh.
First, and then we could get some.
So can you say it into the mic for on the line? Oh, you want me to, okay. So what she was asking is, so the process previously was going to Tina and going through that whole long process, and people might have to go for a time without medication and stuff. So what I'm saying is now just come and bring in, let us know what it is. We can go through the process, but we're not going to see you go without your medication in the meantime.
Okay.
Good enough. Joanne?
I was just wondering, with that being like a new introduction, who's all involved, and is there like a process to it?
So it's basically, we've had a few clients, Melissa and I have went through it on a case by case basis. It will be something that will probably need to go to the committee to have a policy development and go through a process like that. But I do think it is really important that people get the medications that they need.
Any other questions?
So who exactly do they go to?
They can actually would go directly to me, but they can go to home care or whoever in the staff and bring it forward. And then, I mean, I don't see a time of us saying no. So.
Okay. Anybody else have questions?
Folks online can't hear what you're asking, and they want their part of the conversation as well. So if you do have a question, wait until the mic gets.
Question back here?
Sorry, I'm not trying to stand in front of you guys.
Good evening, Randy Lara. I have a question, but it's not for the team, it's for the community members. As a service provider, I run the program, I assist and do programming, various programming on the reserve for regarded to youth. My question for the members and for the ones watching is, what are some barriers that affect your youth coming to programming, and how can we assist to overcome those barriers for youth to come to programming, or any members?
Any suggestions? Do you provide transportation? Good, you provide transportation. Okay, anybody else? Anybody else? We will move on to our very own Jody.
Just if, before that, if anybody just wants to take some time or they're a little bit shy to answer Randy's question, please feel free to contact Randy through either her email that's on the website or through Corey, and Corey will forward the suggestions. I just don't want to leave Randy hanging in the air over there, that she's truly looking for those ways to get more youth involvement. Thank you. And here's our one and only Jody Delorme.
Good evening, everyone. Can you hear me? Yeah. I want to thank Berlin for the prayer. My name is Jody Delorme. I'm the Director of Urban Services. I've been part of the Urban Office for over 14 years. I really enjoy what I do. I have a great team, not as much as health though. That would be really great if we had that many. So we have Brighton Laurent. He's our program coordinator. We have Jeannie Haywehe. She's our program assistant. Unfortunately, she couldn't make it this evening because she had programming. We have Shayla Wing. She's our administrative assistant. We have Sandra LaValle. She's our custodian. She also does casual receptionist work for us. And we also have Lindsay LaRoche. She's our casual. She ran our summer youth camp. Next slide. So the Urban Office was established back in 2002 to deliver programs and services on behalf of its membership. So these are all the programs that are offered within our policy. We have a membership assistance. We have mobility assistance program, extended care and lifestyles. Maybe I should explain a little bit of what each program is. So membership assistance is to assist any members that need to travel outside their city limits to attend medical appointments. Mobility assistance program, extended care. That's for any medical that's not covered through non-insured health benefits. We have lifestyle. So if there is a member that's needing like a scooter or a walker or something that's not covered, then that's where that falls under. We have our transitional assistance program. So that helps to transition into new employment, short-term training, or if they need to relocate for a new job. We have a youth assistance program for schools. So we pay for school fees and we do school supplies. We have our home ownership program. So that's to help with purchase of your first home. So that helps with up to $5,000. We have our home renovation program for our seniors 55 and over, and that's up to $5,000. It's to make their home more accessible for those living with a disability, or to improve, if there's any health deficiencies in the home. We have our medical transportation services. So any of our seniors over 55 that need rides in Regina, or anybody that's living with a mobility issue. We have our comfort allowance that helps with paying for toiletry items, or if they need assistance to get to the treatment center. We have driver's license program, and that helps with the 6 hours in car and in class. So these are the statistics from this last fiscal year of how many members we've assisted. So under the home ownership program, we've done 3, home renovation program, 6, mobility assistance program, extended care, 26 members, membership assistance, 22. So under our youth assistance program for school, 34 received assistance with school fees, 45 received reimbursement for school supplies, and we distributed over to 138 youth for supplies through the Urban Office. Our driver's license program, 3 members, comfort allowance 1, and we have 4 seniors that utilize our medical transportation services. Next slide. So these are the Christmas dinners this past year in Burnaby. We had 133 attend. Yorkton, we had 183. Winnipeg, 151. Regina, 750. Saskatoon, 152, Edmonton, 145, and Calgary, 178.
Might we say with the best ever jokes from council that there ever was
Yes.
in every single, mostly by Councillor Brandon.
So on top of what we provide through our policy, these are all the programs, services, and events that we have throughout the year. So we have our Come Eat program, which is held once a month. We feed quite a bit of our members. We do about 100 plates. We have our volleyball program that Brighton Lara facilitates, but I think that's on hold right now. We have our senior meetings. We have our men's and women's group meetings, adult, senior, and youth outings. We do adult, senior, youth craft nights. We do Mother's Day social, Father's Day social. We have our community barbecues. We do Pride. We have a summer youth day camp. We distribute exhibition passes, school supplies. We assist with the Queen City Marathon. Then we have our Christmas dinners, and we do status card clinics, and we do senior potlucks and bingos. And we also did a grief and loss program. So, and these are our upcoming programs and services that we want to do. So we did a call out for adult slow pitch team. We've had 20 that hopefully will 23. Okay. And then our youth music program. So maybe I'll get Brighton to come up. He'll kind of explain some of.
How's everyone doing tonight? I'm Brighton Lara. I'm the program coordinator for the urban office. We had over 20 people register for our adult slow pitch team. It's the first time it's ever happened, which is pretty awesome. We'll be able to play slow pitch as a community for I think starting at it's like middle of May to the end of June, I believe. We'll see how that goes. And if it's successful, we'll probably continue with it. Our youth music program, I applied for a grant through Sask Arts to have a youth music program at our office. And we actually have a band member who's a level 9 music teacher, and we're going to utilize her to teach the kids. In the future, we'd like to try to do it digitally for all of our youth members across Canada, but right now we're just going to stick around Regina area. Land-based learning. I found another grant through Cabela's and Bass Pro Shops that I'm going to try utilize to do some cultural activities and land-based learning for Regina members around Regina area. That includes like canoeing, medicine picking, hunting, fishing, basically that kind of stuff. Our open house. How did you want to do this again? The open house is here. You can explain this. I'm just gonna go back and forth.
So the urban office has been open for, quite a bit. We've never had an open house. We've never had an open house at the urban office. So, it would be nice to get our members to come to the office, meet our staff, and just kind of see what we do. I've been with the band over 14 years, but actually I started back in 2006. So I don't ever remember them having an open house. And our fiddle dance, we actually had our first fiddle dance this year. Our seniors were kind of asking us to do this. So we tried it out and it was a good turnout. We had over 150 in attendance. They really enjoyed themselves. So I'm thinking this is something that we'll do every year. Oh, what else can I?
We're going to try to do like every change of seasons. We're going to do a fiddle dance in Regina. So, and on reserve people, you're welcome to come as well. Our youth athlete development camps are basically just throughout the week, starting hopefully the beginning of May, we're going to be offering youth athlete development camps for Regina area. This will give opportunity to our youth to try out golf, canoeing, archery, track and field, soccer, and fast pitch and softball as well. So that's going to keep us pretty busy. We have a lot of registered youth right now. I think we have like over 35 in Regina, which is awesome. Mental health and wellness initiatives. I found a grant through TELUS. I applied for it. It's worth quite a substantial amount of money, and what we're going to use it for is to provide programs and services aimed at obviously benefiting our urban members with mental health or wellness initiatives. That means giving them gym memberships, possibly paying for more adult sporting kind of stuff like teams, fees and stuff like that. Our support and social groups, we have a youth group that happens once a month, not including crafts. So we do an outing once a month, and then we do like 2 or 3 craft nights for our youth. Our women's group meets once a month and does an outing once a month. Our men's group was on hold for a bit, but we're planning on bringing them back. And our seniors probably get the most social activity out of our office, which is they get a meeting, they get potluck, they get bingos, they get all of our urban members are allowed to come by the office whenever to stop in, say hi, visit. Educational workshops, we would like to do some more educational workshops for our urban youth and adults and seniors as well. That means bringing in like hunter safety, PAL courses, yeah, some self-defense courses for seniors and women or even youth, babysitting courses. I think that's all we had for that, etc. Just cop out real quick, yeah. Cultural revitalization workshops. We in the future here, we want to try bring in some elders that are able to teach our urban members about protocols and practices. We have a various amount of urban members who've come forward to express that they want to learn that stuff, and they're at that time where they're ready to learn. So we want to try bring that in, and then social gatherings you can do.
Okay. So for the social gatherings, we want to kind of do a little bit more potlucks, just open up the office for our members just to come and visit us. And one of the things that I want to try do is maybe once a month, do programming in Saskatoon, start off there and then kind of go from there. We don't want to leave anybody out. We it would be nice to have an urban office eventually in, another major city or, like my staff is great, for only couple of us. They do a lot of programming and it's just amazing. And, they really enjoy what they do. And I love my job. So I just hope that we can, continue to do this in other urban centers and, not just go out during Christmas time, like what you had stated, right, Chief? You want to go out more often. Yeah. But next slide. So we've had over 220 members participate in our program that's been administered from our office this past fiscal year. Yeah.
Thank you so much, Jody. I'd like to call up Councillor Curtis Delorme, who is not on the committee, but I said it's because he's the boss of all bosses. And we heard a lot about the programs and services that are in the urban area, but really from a governance perspective, we've done a lot of discussion, especially about portability of treaty rights, about the fact that we have Lyndon can correct me here, but over 3,700 members that live off the reserve. Some about that amount. So when you around there, and so we have a large responsibility to those who live off reserve due to the portability of treaty rights and the fact that we're all Cowessess people. And Curtis speaks and leads our team on behalf of those urban initiatives as well as the governance and where we're going. So Curtis, come and be the boss.
Thank you, Chief. Thanks, Vernon, for the smudge that's sitting there. Thank you, Kelly, for your presentation, and for our urban services, and Jody for all your hard work. It's so amazing that your team is so, like you said, it's so little, but you guys are doing so much big things for our members, and it's really heartfelt because I share them every time on my Facebook, and other bands across Saskatchewan are starting to copy it, right? So I have a guy from Pipot. He's starting to do everything that we're doing now. So he's trying to get in on console. He's trying to get in on console for following our programs. So I wanted to state that just because you guys are molding stuff out there, right? So it's really appreciative. And we made a commitment over Christmas that we are gonna go out to each major city to visit more, not to just visit, but to reconnect, right? So one of the things that we talked about was starting those committees in each city, and that's one thing that as the urban counselor, and if the team agrees, we will have those all set in motion. For your first task that you want to do in Saskatoon, we'd love to come along also and be a part of it, even if it's just to sit there and play games and all that stuff. Oh, you're getting me emotional. Jody's also pregnant, everybody. She's doing really hard work and she's pregnant at the same time. Yeah. Yeah, so that's strong dedication for for all that she does, and she's a great leader to all her 3 workers. Four, yeah. But that's something that we want to let you guys know. As chief and council, we will back up the urban office to help you guys support any programs that you guys move forward with, right? And we love you guys. Thank you very much for all your hard work. And we're looking at, and we will be in the future looking for bigger space for not to have small groups, for bigger groups, right? And one thing is, I mentioned when I started running, is that we're bringing the Jay's Care program to Cowessess, and it's successful. So we have White Bear, Zagame, Ochapways, and Cowessess will be involved in the Jay's Care program this year. And Kakwish to hell. And we offer it to the urban youth to come out and play with them to reconnect with our members back home.
And in case anybody's wondering, Lindsay is actually Kiki. I was like, who's Lindsay?
Well, that's a very good report. Anybody have any questions or comments about what's going on in the city? We have you, Brandon.
Just about your land-based learning. Do you need any berry pickers? No, I've been trying the last couple of years using my crossbow. It hasn't been very successful. But another one with I guess our trap lines and stuff. Not those ones. Just gonna ask just ask the crowd in general. Here's some of our dumb Christmas humor here. Since I'm the funny guy. How do you catch a unique rabbit? Unique up on them. See, we're getting there. We're actually starting on the right foot for our hunting here. How do you catch a tame rabbit? The tame way, unique up on him. That's all I got.
Anybody else?
If you want to learn how to shoot your bow, you can come shoot with the kids. I think we're choosing Sundays in Regina to do that.
Right on. We got another comment over here. Curtis.
I forgot to mention also that Counselor Allison and myself will be joining the softball team.
Right on, right on, right on. Anybody else? Anybody else? Rhonda Lee.
We have on the nation, I would say 70 plus seniors that are 65 and over. And what I'd like to see is mental health support. We have some adult children that are looking after their elderly parents. Is there support for the adult that's looking after their parent? You know, we're a very fortunate community. When we have 70 plus seniors that are 65 and over, our community is full of wisdom and knowledge. And I think we need to get out there as community members, as employees of Cowessess First Nation, get out there, go to the homes, introduce yourself, let them know who you are, where you work, what your work entails. I think we might get more support from our community members if they know who we are. You know, it's going to take us to clean up our community. But the sad part is, because many First Nations don't believe in their own community members when they're well educated, when they have the experience, you got to bring somebody in from the outside that's not a community member. And it's a shame that we still do that. We have many community members who are well educated, who are experienced in the workforce. Let's embrace that wisdom and knowledge and that education they carry. Bring them back to our community, work in our own community. I've seen that over the years, and I continue to see that today, that not believing in our own people, and that's sad. Another issue I want to bring up is food security. In the urban area, they have lots of resources, whereas on the nation, we don't have the resources. Some of our families are hungry. They buy food from the store, and that's too expensive because they have to hire somebody to Yorkton at $60 or $100 a trip. That's a lot of money for somebody that's on SA. So we need to look at that. I also wanted, personally, I've been alcohol and drug free. However, my children are addicts. As a parent, I do my part talking to them, but it's up to the individual addict to get help. And sometimes I'd like support from somebody else to come in and talk to my adult children, because they're not listening to me. Maybe they'll listen to somebody else. But in all the years of me living on the reserve, I've never had anybody ever come to my door, knock on the door to let me know they're doing a wellness check. That's something that needs to be done. We have a lot of seniors that live alone. Let's get out there and check on them. We have young people that live alone. Well, let's get out there and check on them. We don't know what one another is going through. We don't know how to deal with grief. So what do? They turn to addictions to mask that hurt and that sadness that they carry. We need to be more of a supporting community to our members, because it's us that's going to fix our community, not somebody from the outside. We send them to treatment centers. 28 days is not enough. We need long-term treatment. In my day, when I was a kid, it was alcohol. But now today, it's the hardcore drugs. And I think we need to look at NADAP. Their thing was to help with alcohol. We need to look at something that deals with hardcore drugs, because we're losing too many people. When you think about what happened in Ochapowace, that's sad. That hurts the heart as a mother and a grandmother I think of my son. I think of my kids, my grandkids. We have to look within our people, our own people, and learn to believe in them. They all have something to give. We're all gifted with something. Let's embrace those gifts of one another. That's another one I was thinking about was Meals on Wheels, because we have a lot of seniors. And from my past experience, seeing my mom, she didn't cook. She ate out of a can of beans, can of tomatoes. The seniors don't look after themselves properly, feed themselves properly. So we need to start checking on them, helping them, whether we do Meals on Wheels, because that's something that really needs to be done. That's all I had on my list, but I could think of some more. But I'm really grateful, you know, Cowessess has a big team of health workers. They've been doing some great things. And I see in the urban area too, they're doing great things. I'm real nosy me. I look to other nations on Facebook to see what they're doing. I want to see what they're doing with their prevention dollars. Because we can borrow from different nations what's working. So again, let's start believing in our own people, believing in ourselves, because we can make a difference in time. Thank you.
Clarence, I'll just respond to a couple of those things. Thank you very much, Rhonda. When we talk about, this is exactly what we need, what we're talking about hearing about what is needed so that we could look at those innovative ways. And so the mental health support for 65 and over and older. I think that we're going to have to look at a way that we're able to do it. Right now, from a professional association perspective, you have to be engaged. You can't go and engage, or else you could get reported to your professional association and lose your status. So in actuality, we may have to look at a person or a worker that is that in between in order to get that health or that help for that individual. So that's one of the challenges that we have, but we always say that that challenge doesn't mean that we can't do it. It's just that we have to find that way to do it. But just to let the people know, that is one of the challenges, is that with professional associations, you can't go knock on doors and drum up business. You could actually lose your license for that. Secondly is that the council is we've had many discussions about how to bring our own people home and how to also work with the people that are already in the community. And one of our biggest challenges for bringing people home is housing. And people want to come home, they want to raise their families here, but to have a safe house, like a safe and a house that's comparable to what they can get in the city, they're very much hesitant, as well as with the job security. And a lot of our programming is just on a year-to-year basis. And so we're looking at initiatives and ways to get around that. As for those who that are in our community, we've had several discussions with Prep Center Barry over there, where we're talking about how we work with people where they're at. So looking at work initiatives where if a person is really only able to work 2 days a week instead of a permanent full-time job or whatever the case is, how do we engage? First of all, how do we learn where a person is at with an assessment? And then how do we work with an individual where they might start off for 4 weeks working 2 days a week and then be assessed again and start to work 3 days a week? So we are looking at those types of initiatives through the Prep Center in order to engage with those that are at home here already that may not be ready for full-time work, but are looking at that. As for food security, you're absolutely correct. We're really trying to look at first of all, the gas station that's here. other than keeping it open. So we all know when it's open and closed. But, once we get that down pat, it's also about making sure that our bread and other types of staples are at cost, and they don't cost any of us any more money. And I would love to say that in the cities that there's a lot more food security. Unfortunately, that isn't the case so much. It's just a different type of poverty for our people that are in the city that, with the food bank, a lot of people rely on the food bank, but oftentimes that isn't available to them either, because there's certain criteria with that. So we're also very cognizant of our members off reserve that don't have that food security as well. So we are looking also at, with Cowessess as well as Ochapowace, that continuum of care of services for treatment. We call it forever care for people who struggle with addiction, because not everybody will always need that intense. At times you will need that intense, but along that continuum of care, it may be less, but something might be a setback. And then so to ensure that there's a continuum of care for as long as that person needs it. And these are all of the issues that we are very aware of, that we're trying to put programs and services in place, and that we're looking at finding the funding right now, as well as looking future for funding in those ways. Kelly, did you want to add something to that?
Yes, thank you, Chief. Thank you, Ronali. That is exactly the kind of feedback that we're looking for, so that we can know, are we going in the right direction? Where do we need to make a change and things like that? So I just wanted to comment on a couple of things. So actually, I feel really happy that I think we are going in the right direction, because the mental health support for seniors is actually something that is on our radar and on the work plan of our social support worker. It's going to come up in the near future. I just need to put some work into planning for that. Meals and Wheels are also on our work plan for the coming year. We recognize that, as our people get older, it's harder for them to cook for themselves. They're isolated. That's a really important thing. And then food security, we have with the dietitian work to put in a Jordan's Principle application to do a food security program for the summer, because we know that the school covers a lot of that stuff for the kids during the school year with breakfast and lunch and stuff. And we know it's hard on parents. Groceries are expensive, and sometimes families have to go without. So that is also on our radar for the summer. And I think the Chief covered everything else. Thanks.
Any other questions in the room? I got some comments online. One, Krista Delorme says there's no virtual access for my son when he is able to access those programs. We do reside in Treaty 6, and we'd like to use some resources for him in the future. Denny's, parents can encourage youth to attend and offer to take them and see what they can do. That's the youth meetings that you're talking about. Where else are we here? Somebody else, Krista says, our band members accessing resources for mental health through NIHB. We do have coverage for that, and most do telehealth since the pandemic. I don't know what telehealth is. That's the comments for online. Is there anything else? Yes, we will, because we're just now tallying up the draws for later. 10 minutes, come back.
Okay, we have 3 questions that we're going to be asking our members, and these will help guide us both at the governance table as well as operations. So Corey? Oh, let's go back. So future planning considerations, Councillor Curtis talked about it a little bit. And on behalf of our team, which I'm going to acknowledge, we have Councillor Terry here today. Oh yeah, Counselor Josh was over here. Counselor Ira, I don't see him, but he was here a little bit earlier. I think he's outside. And I think that's all, 1, 2, and then of course, Counselor Curtis. And that's all of us, right? All right, just making sure that I don't. Oh, the man, the myth, the legend, where is he tonight? Pardon me? Okay, well.
Got here.
As we know, he might not be here physically, but he's always around us. So wherever Councillor Malcolm is, we know that there's a good reason for him to not be here because his heart is first and foremost with all of us in the community here. So in the future planning and considerations on behalf of your governance team, we're really looking at task forces. So we reestablished committees, but what do we acknowledge is that committees are, just by the very nature of committees, they're a little bit slower going. Their tasks or their whole terms of reference is to look at a wide variety of items. And we have very specific things that we're hearing in each of the areas where there needs to be action taken immediately. And so we will be putting together task forces for each of these areas. And those task forces will be action oriented with time limits associated with them to ensure that we get movement happening really quickly. And they will be reporting to each of the committees as well. So the committees will be overseeing the task forces. And as Chief and Council will also be hearing from those task forces also. And the other aspect is that those of us who've been trained, there's trauma centered, trauma informed, and trauma based, which is totally the first one. But anyway, what we're finding, and committee member Rhonda talked a little bit about it, where we're all facing some sort of pain and trauma just by virtue of intergenerational effects of residential school, or actually our effects of residential or day school. And unless we have trauma-informed or trauma-centered plans and programs and services, we're not acknowledging where people are at or where they were and how far they've come to move from that place to one of healing. And so we're working with all of the staff in ensuring that all of our programs and services are not only trauma-informed, but trauma-centered. And as well, within all of the areas are the laws and bylaws that we will be looking at how our laws and bylaws on that road to sovereignty all play within the policy, the Constitution, our laws, our bylaws, our regulations, our policies, and our practices, how they all work together. So we'll ensure that we're very committed to that governance piece of it. Next slide, please. So we have 3 questions and 3 counselors sitting up here. So the first question, Counselor Joshua is going to ask. He has lots of kids. I don't want to get those kids sick.
Thank you, Chief. Okay, the question is, what barriers are there faced in enhancing Cowessess First Nations health services? Accessing health services, sorry about that. So.
Any comments?
Any
questions,
comments or questions?
Questions? So look online. I think we had 17 or 18 online earlier. Anybody, anything online? You can write them a letter. We have our buddy here, Glenn.
Sorry about that. I think some of the barriers that we're facing is lack of space to do these what we want to do with addictions and other stuff like that. Sorry about my throat. I was one of the ones that got bear maced at the powwow. I ended up swallowing it and been hard on my throat since. Excuse me. So yeah, that's one of the barriers that I see, and just a couple comments on what Ronald Lee was saying, and with addictions is that, and with the program that we're running right now, I no, I shouldn't take it personal, but I was feeling kind of like I wasn't doing my job, and that's not the case at all. We spend sometimes 10, 12 hours running these programs. We do evening programs 3 days a week. While everybody's sitting at home with their families, we're out there sitting with your families that are suffering with addictions, and people that are where they're dealing with loved ones that are suffering with addictions. One of the things that me and Vicky been working on is getting this outreach program out. It's a 6-week program that we're working on, and it works on, deals with everything from culture to relapse, the disease of addictions, self-esteem, all this good stuff, and that we're going to compel into a 6-week program. And I explained this before, and in the 6-week program, there's no one's going to be turned away. If someone says I need help today, they're going to get that help. And then I'm just saying this, as long as this program's this outreach program is in the works, there's not going to be a start date. Like they come in the 3rd week of the program, we'll let them in. Also, what we call harm reduction is someone that's still suffering with their addictions. And if you know addictions, if they're out there using hard drugs, they can't just stop. They need that medical help, but sometimes they can't do that. And a lot of times these people that are using, they're using just to stay not sick. They're not doing it to get high, they're doing it to stay not sick. And we would allow them there, and they could continue, and they can come, and if they come stoned or drunk one day, then we'll sit down with them, make sure that they leave safe. And then once they leave safe, then we'll tell them, you know what, come back tomorrow. So there's no kicking anybody out of anything. And we'll just keep going. And I have had talks with Josephine Case-Wastemat, the health director of Cowessess, on opening of their detox center. And I said that, okay, Josephine, if you can help me out here, I says, give me 2 beds and for your detox center, and then you can send some clients over from Cowessess to our 6-week outreach program. And she loved the ideal. It's going to take a lot of work, and like right now, I'm going to let the cat out of the hat. I'm going to be approaching, and with Kelly's blessings, of course, is that approaching Chief and Council to see if we could do Sacred Wolf Lodge for 6 months for a pilot project. So nobody is going to be turned away. If somebody wants to go to a 28-day treatment program, they still can. But right now, it's so common. I want to go to detox. You got to wait. I want to go to treatment. Well, you got to wait. And the programming that we're doing on Cowessess right now, sometimes we get anywhere from 15 to 20 people at one meeting. If you go to Yorkton, you'll see 5 or 10. So what we're doing here is huge. And we're going, I've been at this for a while, and through my work plan and everything, we're going with what's working. Everybody can tell me ideals till they're blue in the face, and if we haven't tried it, we'll try it. But if it's not working, it's not working. And so we have to go with what's working. Also, I've talked to Councillor Curtis, and I know Curtis has his certification in addictions, and that he knows the addiction lifestyle. And I know that if and there's going to be times when I would like to call on leadership to come and say a few words on our behalf at our program. And I know I have asked Chief Erica to come out, and she has. but there's been times where Chief has been busy and she couldn't make it. I've also invited other counselors to come and attend our NA meetings, but then not feeling like, and I got this from Ally, that she felt like she was intruding and that she's gonna infringe on somebody's anonymity, right? Which is understandable. And but then again, our clients know who the leaderships are. And if you come in, that's what they need to see. They need to see the backing of the leadership. I've invited Kelly a few times to come and say greetings to our members that are there, our birthday meetings, and she has, and that, and I get it, you know, sometimes people aren't available to come and say a few words, but I've had that talk with Curtis, and I know Curtis understands addictions, and you know, I would love to work hand in hand with Curtis. And then if Curtis has anything, if I need anything, you know, I go to my boss first. That's first and foremost. But then I know it's a tie between leadership and a boss out here. So, but then I can talk to Curtis, and if I need anything or any support, then Curtis could bring it back to Chief and Council. So sorry about the long comment, but thank you.
Thank you, Glenn. Thank you, Glenn and Anita program. You're doing really a good job for the First Nation.
It is a good job.
Do you want to take this
Any
one?
other comments or questions? There, we got Councillor Brandon.
So I'll do a bit of a response on your lack of space, and that goes back to what you said earlier when we did this group application. We're trying to get all this space put into our new building, the Mio Pomotsuan Center, so you're not having those lack of spaces. And I've told this to Chief many times, like that can't happen fast enough. Like, to me, I want it right now. It just doesn't work that way. We're aware of the lack of spaces, and we're aware that a lot of our departments want more space and they want to run better programs and more programs. Get more staff, get more professionals out here to assist with all areas. So that's definitely like right at the front of what we're trying to do, is to get that building. And hopefully that you will have those better spaces. And what that's going to do as well is, because we're going to put the daycare in that area, that's going to free up the daycare building. So now we have another building that we can repurpose and put into I guess whatever we come up with. Maybe it is another building for a detox or those kind of services for health as well. I don't want to say that is going to happen to that building, but that's an option. But for right now, yeah, we need that building. We really do, and we're going to help more people once it's there. We're waiting on the response for that application. We're waiting on a response for another grant application too. So we're waiting on a response for 2 applications that's going to get those projects up and running. The other one, I just want to kind of touch on this food sovereignty, and this goes to what Councillor Terry talks about a lot too, is get this into our classrooms, get our kids growing food. I started this the first time I left the city. I was living out on Carry the Kettle. We started a garden out there, and I'm starting to do one this year. So we're starting to do a garden this year, and we're growing some plants inside. But to do this with our kids now, not the I guess you can do some indoor seeding and preparation that way. But I think for our kids, it's gonna be cool to see them like growing food and whatever they want to decide to grow, fruits and vegetables. But that's another thing that we need to work on, because to me, it's as simple as me saying, hey, education has a tiller and a tractor. Let's go to houses and start ripping gardens. It's not that easy. Like, to me, I think it is, but for some reason there's those little silos, or it's their tiller, it's their tractor. It's not Cowessess's. We can probably go the route of getting one ourselves, but I think to even get something that as simple as a tractor and a tiller to start helping our people get garden beds going, and a place to do the indoor seeding. Again, with Councillor Terry, he spoke about greenhouses. We should be able to get a greenhouse where we can start these indoor seedings and give that learning to our kids. And then when they're gone home for the summer, they can still watch their garden grow throughout the summer months. They come back in the fall time, they can share what they've done in their garden. whether it worked or not. And hopefully we have a lot of our kids that can actually succeed at their gardens and they can learn from our people that used to do it, because we haven't. I grew up when I was younger and I remember seeing gardens, but up until like now I've never really gardened. I've never really done it myself. So it's gonna be a learning process for me too, whether I succeed or not. So that's just kind of just going on you. And I know you guys work a lot. I know you guys are trying to get the programs, and it goes, people have to come to you. We can't go to them and say, hey, we see you're struggling with something. It's up to them. It's up to those people to walk to wherever they want that help. I would really like to just pick people out and be like, hey, let's see how we can help you and get you living a better life. Because I think at the end of the day, that's all everybody wants, is just to live a good life and not have those struggles, whatever they are, if they're mental struggles, physical struggles, addictions to substances out there. But I really wish we could just do that and then take people out and help them, but it's just not that simple. I think a lot of us have probably experienced that personally, that we've seen our friends and family going through stuff and we wanted to help them, but for whatever reason, they don't see it. So we're aware of that, and we have sympathies for those people, and we often send our prayers out to them as well when we have our prayers that, you know, help our people that are going through addictions. And we really want this space for our people, because I think it's really going to impact a lot of our membership on reserve, and then to duplicate that and do the same thing off reserve and give those same services off reserve as well. So we're trying. It's just waiting for these applications to go through.
I have a new name. Anyway, thank you, Terry. I just wanted to say, first of all, Brandon, we have a garden program, and if you want a garden tilled in your yard, we can get that done. And so we do. Oh, or if you want to use your shovel, that's fine too. Anyways, and there is seeds and seedlings and things that go along with that. So I think that though that's a really good illustration of some of the barriers are faced. Like, obviously some of the things we're putting on aren't reaching people, and so I think that that's something that we need to remedy, because we want everybody in the community to know that things are going on. Sometimes we have events or have programs and we don't get like a huge turnout and stuff, and it's kind of too bad. So even, you know, we haven't had like lots of people speak up about what barriers they're facing, but even, you know, if you're shy or whatever, please come in, talk to us. My door is open. I really do want to know what can make it easier for people to access services, because we wouldn't have jobs if it wasn't for the community members, and that's always really important to remember. And so it's really important for us to be able to reach people and, you know, meet their needs as best as we can.
Hey, I was wondering if they had assessments for the barriers or what the people are having what do you call that, hard decisions, I guess, to make to even come to your services. But even with our chief and council there, we were always wanting to convey about character development, and I'm always going to talk about that, because you got to understand your own integrity, where you want to go and who you are, and we all have a purpose in this world. So yeah, the barriers, maybe we should do an assessment on why our people are not coming to these programs. Did you do anything like that, Kelly? Thank you.
We haven't. We've actually, that is something that's on my radar, to do a needs assessment, but I also know that there are lots of different groups in the community doing kind of questionnaires and things like that. So I'm just not sure that is something that is on my radar to discuss with the executive director. But it's definitely we want to hear from people. So perhaps that's a needs assessment. Perhaps it's like a Google questionnaire or something. Like, I'm not sure exactly what that would have to look like, but we also don't want to, we want to get the information and not overwhelm people with always asking them for things also.
A couple of comments online from Myra. She says, Ron Lee's awesome words when they first moved home, they helped Audra's seats in home care. We made meals for 5 seniors, 2 lived alone, so we'd sit and eat with them. I know how they felt eating alone because they don't eat. And it's hard to get a family doctor. That's a comment from Denise Pelche. I'll let Glennie again.
Okay, just furthermore on the outreach program, all I was I'm working with Kelly and Victoria. We're just about done. I've utilized Tina and Barry here as well. All I'm asking for is that if for the use of Sacred Wolf Lodge for 6 months for a pilot project to see if this addictions outreach program is going to work. And if it works, then fine, then we'll have to find a different avenue, different way, or different funding to get this going. But at the end of the day, we're not going to know if we don't try.
I just wanted to make a comment about, first of all, we know that addictions and mental health is one of the largest areas that we need to address as a community, but also as a nation, because it's everywhere. And it isn't, there is absolutely addictions overall. If we talk about the correlation between the mental health and addictions. And so right now, what's life and death is crystal meth and fentanyl, perhaps crack, and what's associated with that. And we've seen it both on and off reserve. And it affects every single one of our families, regardless of who we are. And there is no easy answer. We know that our addictions area does as much as they possibly can. It's hugely underfunded. We also acknowledge that, people are where they're at, and sometimes that's not where we as families want them to be. And that's the incredible sadness that we as family members carry. And I talk about sometimes that before I became chief, we ran a homeless shelter at the organization I worked with, and 95% of the people there were addicted to crystal meth and fentanyl. And in our teachings with our staff members, it was always, remember, every single person that you meet deserves to be treated with the utmost dignity, because first and foremost, they're loved by Creator and brought to us by Creator. And then secondly, they have families that love them so much, but they have exhausted all possibilities to help them. And that's why they're here. And that's some of the issues that we have on reserve here as well, is that people deserve to have that dignity. However, unless people come for that help and ask for that help, then we can't really do anything. What's our responsibility is ensuring that at that point of access, we're able to give the type of help that they require, as well as that continuum of supportive care and services that are all around the addiction. And apart from that is we concentrate and prioritize, because we see it the most, especially when it comes to community safety, the impact of alcohol, or pardon me, drugs, hard drugs. But there's also incredible impact when we look at all of the other addictions as well. Food addiction, which we talk about with the type 2 diabetes, when we talk about the types of foods that people eat, and they, because of poverty, a big thing of noodles like this is, I think, $10, which might feed your kids for 3 to 5 days. but there's not one bit of nutrition in that noodle package or box as it is. So there's so many things that we can talk about when it comes to addictions. It's food addiction, it's sex addiction, it's gambling addiction, it's cigarette smoking. It's all those types of addictions, and some addictions are more acceptable than others, but all have impact. And that's what we have to look at is impact, whether it's at the beginning or when it's incredibly serious. So as a council, those are the types of discussions that we have as well, is point of access and the ability to assist people when they do come, because sometimes that window is incredibly, incredibly small. And we have to do better. But in order for us to do better, we need to have the funding and we need to have the human resources, as well as the knowledge and the capacity for what we're able to do, that we have access to treatment centers, that we have access to detox and treatment centers, and then also aftercare if it's unsafe for people to come back to the community here. So it's a very, very large subject that we're looking at when we look at the, mental health and addictions.
Okay, comment from Denny. She's saying that, it's too bad we look at numbers for success, but even a few people turning up, that's a success. Because like I look at the department, been here all my life, and when we had health when we first started with the 70s, there was nothing. We had nothing, and the amount of activity, like even with Glennie's program, that's a lot. That's better than nobody going. And there was times you didn't offer any kind of services for that. So I think there's a lot going, an incredible amount going here. So anything else any more comments on access? That was the access. Going to move on to the next question. Next slide. Who's doing the question? Allison?
Test mic 1, 2, check. Counselor Brandon, check mic. Thank you, everybody. The next question is, how can we better advocate and or provide better services for members living off reserve, especially those who do not live in Regina or Yorkton within a 200-kilometer radius of our home reserve, the nation here?
Might call that rural, some of the rural towns, some of the people living out in the country.
One of the first things that we did is that we have opened up, before it was on reserve, you had to actually live on reserve. We have actually opened up services to be considered on reserve if you live within 50 kilometers of the home reserve. So it could be rural, but those that live within 50 kilometers now are eligible for the services that we provide on reserve.
Else, rural populations, or rural people. Anybody else? No comments on there online? Nope. Yeah, good. You can one over here, Randy. Randy, our very own Randy.
Good evening, it's Randy here again. I'm gonna speak closer to the mic because apparently I didn't speak close enough before. Was that on purpose? So when I think about advocating for off-reserve members, and this is about off-reserve, I think that a good idea is like collaborating more with on-reserve and off-reserve is definitely one of the first things that I thought of. And I say that because my programming only covers on-reserve members, right? So I can't really go outside that. However, I could partner with, like, say, Chief Red Bear. I had the pleasure of had the pleasure recently to go on an Edmonton trip with the youth, and that's where we collaborated with Chief Red Bear, and we took youth on reserve and off reserve. That's a start, because there's and some of the stories that I've heard from the off reserve members, from the youth, is like they want to know more about home. They want to have more connections with home. They want to find ways where they can like connect with on reserve youth or on reserve families, or like there's people that don't even know who their families are on reserve. So to see and experience that in the last couple of weeks, to see that collaborating and that networking amongst off reserve and urban youth, or urban and on reserve youth, was just, it was beautiful to see. These friendships are going to be forever lasting. I seen posts just recently about some of the youth in the urban excited to go meet their on reserve friends. So like things like that are very inspiring to me. And I'm grateful that Cowessess and Chief Fredbear gave me that opportunity, and all, as well as all the youth. So I think that's a start, is just more collaborating with departments. You know, I heard Brighton talk about some really amazing programming coming out of the urban. And it would be nice to like network that and bring like maybe on reserve kids up there, or invite off reserve on reserve, because that is a barrier for some of our young ones. Is it's intimidating, you know, like as a kid, you know, where do you go? Who do you, like, you don't know anybody. So you kind of need that little, you know, support to get your foot in the door to start establishing those connections. So yeah, thank you.
Excellent.
Yeah, yeah.
Right.
Check.
Right.
Yep, yep. Bingo, bingo. Go online first. Go online first.
Terry, you missed a question about before break. Oh, no, Debbie, we did not miss we didn't miss your question. She was asking about the painkillers for urban seniors that are not covered. Do you cover the urban seniors? No? Yes, no? That, do you have any, it's okay, hang on. Because
So in our policy, we cover medications, but we don't do prescription painkillers.
no prescription painkillers, but she does pay for stuff.
To also kind of piggyback on the question, this is for people online. This is Councillor Curtis DeLorme. One of the ideas that was thrown around our council table is also to work with our departments, but not step on it, but kind of help them out in areas. Because myself, Councillor Allison, came from a background working with youth and being able to do all these kind of activities. And one of the biggest things that we did and found where the voice came from for programming was from the youth by doing a youth conference. So that's one thing that we want to throw out there with our departments, is with the backing of council, is to do a Cowessess First Nation youth conference for on and off reserve. And with that, that's, yeah.
Just touching on what Randy was asking about. Yeah, that's a very good idea to collaborate with On Reserve. I think we planned on doing that eventually. We just haven't been talking. She blocked me. No, I'm kidding. I'm joking. No, I'm kidding. But on a more serious note, we'd like to invite On Reserve to take part in our athlete development camps with us as well. So I'll be emailing Sports and Rec on Monday. No, I'm just saying no. Tomorrow I'll email them and see if there's any way that we can get some of our On Reserve kids up to the city to come take part in our athlete development. And yeah, cultural, land-based learning and stuff like that. I'd like to collaborate with you on that as well. It'd be pretty awesome. Yeah. Yeah, we can come out here and just, it could be like a week camping thing, you know, like we can do multiple seasons even, right? We can do in the spring, we can do in the summer, and then in the fall, even try for the winter, right? That'd be pretty. I think I got half of you guys beat anyways. No. But yeah, that's all I have to say about that. Clap.
Good show. Anybody else? Who? Okay. Anybody else? What? Old jokes.
That's all I got.
Is that another one online? What did they say? This one? Okay. Crystal Missins says, I have a niece who lives in Saskatoon. Will there be anything made available for the ones in Saskatoon for the youth sports program? Anybody?
We're just planning right now, me and Jody, on ways we can include, I guess, some of our Southern Saskatchewan urban members. I think we're looking at ways to provide gas and mileage and stuff like that to ensure that our majority of Southern urban members can take part in the athlete development camps.
Joanne is here.
Just an option for that, for you guys would be maybe offering some sort of like a room and board with some of our urban members, like renting an Airbnb instead of offering mileage back and forth, because that can get pretty costly depending on the gas prices. And same with bringing urban out to the community. If we had community members that were willing to open up their home or utilizing the lodge to do sort of a room and board option for some of those programs.
Good one. Anybody else? Rhonda? Rhonda Lee. Why do I say Rhonda? Rhonda Lee.
There's a National 60s Scoop Conference happening in Winnipeg on next Monday and Tuesday. And I'm just wondering, like, if we have any urban members or wherever they live that were part of the 60s Scoop, and would the urban office fund them to attend this conference? Again, it's short notice. That's next Monday and Tuesday in Winnipeg.
Didn't know that. Ooh. Anybody? Yes, no?
Oh, the cost on this? No, okay. Well, I think we can look into it this week, but that is pretty short notice. Yeah.
Yes, it's short. Anybody else? Question? Third question. We're going to move on to the third question. Who's taking the third question? Brandon? Council Brandon, lower sub.
What are your top priorities for Cowessess First Nation healthcare services?
Top priority. Anybody having a top priority? You have something?
Membership.
Any
Membership's top priorities for health.
top priority for health or urban? Oh, healthcare. Anybody? You can send suggestions online too after the. Okay, hang on. I'll get Carol back here, and then we'll come back to Brighton.
Just a comment here. We go to Broadview Hospital and we go there to die. We don't have no doctors there, and they're so busy. Doctors transferring in and out. None of us could get what do you call those doctors that take care of you all the time? Family doctor. None of us could get a family doctor because and Cowessess and the First Nations put a lot of money into those hospitals, and we don't get the services. Every year, Canada funds hospitals, and they use a lot of our Indian money to fund those hospitals, but yet we don't get the services there. So I think our leadership has to advocate for better services within Broadview or closer to where is access to the people on the reserve here. Another concern I have is, are we still 100% immunization for our babies? And I think we have to ensure that happens, that our babies have to be inoculated at 100% on the reserve here. Even if we're kind of transit, keep track of who comes and goes and make sure that our babies are have their needles up to date. Another one I have is is our children, our special needs children on the reserve here that does anybody ever go and check on our autistic kids, see if they're getting assessed and see if they're getting the services they need through health? Nobody goes to see our autistic parents. I think it's the health department that should be on top of that for our kids, for our young ones that have special needs. And I think that we should have a relationship with speech therapists and hearing doctors and other specialized in children's needs for our autism kids at under reserve here. I better quit here.
That's a whole lot. I was just gonna ask a question. Do we have a board member on the Broadview Hospital? We used to have some kind of representation over there. Oh, she is? Deanna? Okay, all right. Just wondering. Here. Right.
I think our office is looking, well, how are we? Our top priorities for the urban office are, well, for healthcare services would be probably just offering programs and services that promote healthy lifestyles. I know we talk about it a lot and we do a lot of planning. In the past, we haven't been doing, a lot of the 4 components of the medicine wheel, right? So I really want to change my ways as a program coordinator and kind of use all aspects of the medicine wheel this year. And yeah, so our priorities would probably be just offering programs that promote healthy lifestyle. Jeannie was looking into actually for our older urban members, getting them into Cowessess so they can like get in the water and do a little bit of exercising in the water. And then the youth are doing these athlete development camps. We're trying to get some more engagement from our adults to take part in these different community building initiatives like slow pitch and stuff like that. So it's a start, but it's only going to get better, right? So
Good show. Well, everybody's growing, everybody's trying. Also, since we got those free, the free admission to the what do you call those? Yeah, I lost all of those places. I went there a couple of times. Last time I went to the city, you just about pop in there. Anybody else? Top priorities for Cowessess? Who?
I'm just wondering, is health planning in the future that there is a need for our First Nations people to learn the ceremonies, like the horse dance ceremony, the wiping of the tears ceremony, the combing of the hair ceremony. These things we need to bring back so people have an understanding of what it is and why we do that. Thank you.
Okay, I think I can answer that, for the health department, we have Erlen Nicotine here and he does most of the cultural stuff for us and, but we also have Grady and, Owen and that health team with Chief Red Bear Lodge. They're doing the same things out there and, we don't want to be duplicating services. I know I've sat with Berlin a few times because I am involved in my culture too and we've talked about things and how we could help and he's available all the time to help out wherever he's needed and just have to approach him. And he does know the protocols. And before I give it to Kelly, I think answering our own questions from addictions, one thing that we have to do is we have to get into the school. And I don't know if you guys know, but my sister Vicky here. It's just a joke. I told Counselor Curtis, I said, this is my new assistant, Vicky, and he said, oh, well, she's the better looking one. And he thought he thought I meant that she was my sister. So anyways, since Vicky's been with us, we've been trying to get into the school, like, and it's not because the school won't let us in. It's just that every time that we try go in, there's something comes up, and we're trying to get Alateen set up for Wednesdays after school for the kids out there to come in and talk about their issues with addictions. I told Vicky, okay, this Wednesday you're going to the school, and she's getting ready to go. There was no school. So we're gonna get there, and then also one of the things that I want to do with myself and Vicky and is go into the school and go into the older classrooms grades and talk to them, and I've done it before where I've asked the teachers to leave the room, and at first the teachers didn't like it. But the only reason I do that is so I can get that honesty out of the kids, and I let them know that anything that they say there or hear there, it stays with me. It doesn't go anywhere else, unless, of course, they're going to harm somebody or somebody else is going to get hurt. That's then I have that duty to report. So we are going to get into the school, and then there's another one, but before, and then I'll just leave it with this, that you know, with addiction services, if there was just me, I wouldn't be able to do it. There's no way I wouldn't do it. And we have my bro here, Barry Sparvier, who steps it up, comes and opens up the meetings. He attends the meetings. He does whatever he can whenever his woman doesn't have him around. Then, of course, Tina, during COVID, the Cowessess had no addiction services, and Tina has always stepped it up and always has been a huge part of our team. And then now we have Victoria. So any given day, the program that we do in the evening, the doors are going to be open because of these three awesome members.
Okay, on that note, what I would just like to say on behalf of our team is that one of the areas that we saw lacking, going back to Ronalee's question about culture, and so that's actually a question that is very much being seriously contemplated and discussed right now with our older people, and we have a culture and language team, and we're trying to standardize services. So the question for that we were asked by Ronalee is actually should be answered by the culture and language unit. And that's part of us not siloing and just expecting Verlin on, who may be getting paid. He's part of that other team. And so what they're doing is talking to the old people to see exactly how to bring back ceremonies, what exactly the ceremonies are, what is culture, what is spirituality, how does language play that a huge foundational part within that. And it's being done very seriously and contemplatively, because we're being told by the knowledge keepers, the elders, that if we just start bringing back ceremonies, that might bring more harm to our community than if we do it in a very systematic, methodical way. And so that's the way that we're doing it, through one unit and one department. And so the school isn't going to do it by itself. Health isn't going to do it by itself. It's going to be done collaboratively and together. And there'll be no renegades within that. So thank you. And Berlin, I'm sorry that you had to go through that discussion, because it wasn't that funny.
Okay, he's gonna explain himself.
Hano ako maganak at siopit ba Berlin nicotine sigas. I'm with health, but health got me at the school, and at the school I'm promoting our culture. Like for me, I go sweat not only Grady's, but I go to Sactame, I go to CAC, I go to Ochapoy. So I have my my down south ceremony family. Like that's how we need to have a family. That's how we could bring back a lot of our teachings by going asking these questions from making our circles bigger. I know like residential school, it kind of stopped a lot of our ways from being passed on. Like that's a law in itself. Where we're supposed to put our children within these sacred circles. Residential schools stopped that. And you could tell by if you look around at our jails, our child welfare systems, the streets in the city, a lot of those people, guaranteed, most of the people in here have not been put in those sacred circles, and maybe some of us went down that wrong path, and the ones who made it out, they're fortunate. But there's a lot of people that didn't make it out that are still stuck in those cycles that the residential schools created. For me, I'm at the school, I'm promoting the culture to the young children. Most of these kids have never been to a sweat before, and they always want to come back. They always asking me, when's the next sweat? When's the next sweat? So for me, I take them to wherever there's a sweat happening. There's one actually tomorrow, which I'll probably take like four children from the school. So for me, like this, like, how they promote summer games, winter games, well, we have to start promoting our sun dances, our rain dances, and our horse dance and chicken dance and all the ceremonies. And then when we start putting ourselves there, that's how we're gonna learn. You can't learn this from YouTube or from a book. You have to actually be there to get that full understanding. And the language too. Also, up speaks in the hill in Nista. I just speak a little bit of the language, but I'm learning. Especially at the shake tents, the spirits, they don't talk English, they talk the language. So lucky we have one of your guys' members that I just met a couple years ago, Darian Ajikute there. He's like our translator. He's always involved with our ceremony family now. So for me, I'm just hoping I could take some people, families, children, whoever wants to come, to the big lodges this summer, and the sun dances, the culture camps. There's culture camps, and then there's culture camps. Some of the culture camps are where people who live this way of life, who are sun dance makers, who are chicken dance makers. People. Those are the culture camps that I like to take people to get that full understanding. Get back to who we are as Indian people, revitalizing. We're talking about revitalizing. And, there's healing within our way of life. This guy was talking about the medicine wheel, mental, physical, emotional, spiritual. For me, spiritual being the most important one, with that spiritual connection and our connection to our higher power. It'll take care of the rest, like that emotional. Like the sweat is called the Matutsan Lodge, the crying lodge. We have to let it out. We can't keep it inside. So we got to let it out. Or when we have pipe ceremonies, we share. You're not only sharing it to the people there, you're sharing it to the spirits that they came in with that pipe. That pipe opens that door to the spirit world. And that's that emotional. We got to let it out. Or you can go see a therapist or talk to your elder. But for me, the spiritual part is the most important. But I recommend them both, like the modern and our way of life, like even the mental, like just learning all these things, learning how to build a sun dance, learning which grandfathers sit in which directions, learning how to do a pipe, learning which kind of rocks and how big of the wood to get for a sweat lodge, learning all these different protocols, learning there's so much to learning the language, learning the plants on the earth, like this one has 8 ingredients. So that's 8 different spirits in here. You guys just see just a plant. You guys don't see that grandfather, that grandmother that sits in here. And the grandfathers and grandmothers, that 8 of them in here. And this is thunder smudge. That's that learning, that mental part, and that physical part, just gathering all these medicines, building these sun dances, being available to go help and be oscapeos at these places. That's that physical. Or we could go to the gym. Our sports, there's, for me, that spiritual and the medicine wheel is the most important one, and it'll take care of the rest. And that's why you can have a healthy, our wheel will be going good instead of just like flat. Also, there was one more there. That's the only way to learn is by just putting yourselves there. I guarantee it, like in 10 years time, we start putting our children there. A lot of our ceremonies will be returning. You know, we gotta look further down. You know, I hear Dutch say at one of the elders. We have a monthly elders group here. Dutch was saying about you can't teach an old dog new tricks. You know, and I get that. You know, some people are just they're not comfortable with like going to the ceremonies because they don't know, they have no understanding. But for me, I'd like to walk them through there and then show them, like, you know, the only way to learn is just by putting yourself there, even though you don't know nothing, you know. So that's where I'm here to help. You know, I'm not here to offend nobody. I just want to get back to what our ancestors used to practice. Yeah.
Excellent. That's an excellent one. We'll let Allison make some comments and then we'll go over to Lyndon.
I really would like to extend my gratitude to Verlin for providing all of that for us and to bringing our medicines, which are alive. My name is Tatanka Wachampiwin, and I would like to just to have a rebuttal about the decorum in the room and how we treat one another. And in one of my teachings that I've learned through working and listening in my roles that I've had was that if you kind of scared to say something, but you're in your guts, that's your grandmother is telling you to say because you're connected at the umbilical cord. So I feel like I want to stand up and apologize to our kokums in the room for the decorum in our last couple minutes of our presentation. Some of that was unnecessary with the presence of our medicines in the room and the way we want to move, but it's a beautiful lesson to understand. And, you know, as my role as head woman, I felt that to stand up and apologize to you guys for having talk and jokes that aren't quite appropriate for the topic. And it's kind of hard as head woman to stand and say those things with the president of medicine. So I appreciate that all your patience as we move and we heal as a community and we host community events, because that's part of those teachings that are so important and why we're here to listen and learn from each other. So I want to thank Verlin for explaining all that beautiful information. And that's where we want to go to move back to that Mi'o Pamatswin. So it's tough to stand up and say what you need to say. So when I sit here beside my well-respected committee member, and I respect this woman as a kokum, I would not have said that in front of her as in my teachings as raised from my kokums, right? So I got red in the face. So, and that's my truth, to apologize on behalf to our grandmothers in the room and for our children who pay attention and learn and listen. And sometimes that's not necessary and good, moving on in a good way. But also in that is forgiveness and love and understanding and all those teachings that we have, you know. So just in a humble and pitiful way and talking from my guts, I felt the need to, and also to thank Verlin, because you're new here and we appreciate that she come to sign on. And it's beautiful that she brought that Thunderbird smudge for us to enjoy. It brought healing to me as soon as I walked in because I was nervous for today. Thank you, Chief.
I seem to be always shutting people down and stopping people from doing the things that they try to do. I'm a part of the cultural group, and that's a big part of what I do, but that's a gift that I have, is to correct people in the ways of doing things, as in, say, picking medicines. We shouldn't be picking medicines. It's fine to pick smudge, but in the culture group, we even changed the word. They were calling it going medicine picking, and we changed that. We said, no. A person shouldn't just be going in a big group to pick medicine. You have to have the right to pick certain plants, and I mean seriously, a right given to you by an old man that's passing down information or teachings to you, or having even seen it in a vision. That's a given right. You can't just go and pick medicines with 20 or 30 people or even 10 people. That's something you approach an old man who knows these things with tobacco and you do it on your own. Again, with the ceremonies, that's not something to be showcased. We don't just bring a horse dance or chicken dance or whatever other ceremony you want, just to show the people how these things work and how they look. That's not how these things work. You bring bad things to your community when you do that. You bring suicide, you bring death, you bring things that seem natural or normal, but they're very, very bad when you do things that are not done properly. For one thing, with the horse dance, my teaching came from up north. I saw not many, but a handful of horse dances. And it was explained to me up there that the horse dance, that's the last ceremony a person does when they've been walking the red road most of their life. That's the last thing that they do. So you don't just come out and bring a ceremony to a community just because everybody wants it. That's the wrong way to go about things. You talk to an old man who knows things. I'm not an old man, and I don't know anything. To me, I still have lots to learn, but I do a lot of correcting of people when they try to do things and take shortcuts. That's not something we do on this red road. We do things right. We do things the old way. There is no changing. There is no shortcuts. Oh.
Thank you for everybody in sharing this evening. This is honestly about community growth. This is about us healing together and moving forward. And this is the bravest and most courageous crowd that I think that we can honestly have. And this is not the surface stuff. This is the stuff where we're digging deep. And that digging deep is what we need in order to truly heal ourselves and be part of that healing for the community. And so when we talked about culture and language and spirituality, that's what we're talking about, and that in how we are going about it together, but in a unified fashion. And that's part of the integrated programming, where it's not just culture sits in Chief Red Bear Children's Lodge. It doesn't just sit in health. It doesn't just sit in membership. It's all of our people, and it's not only staff. We're asking all people to assist us as we move forward with their knowledge and learnings as well. So we have a long ways to go. We have to remain true to those grandfathers' teachings, and to have that humility, that love, that kindness, that respect, that forgiveness, that patience with ourselves and each other. And tonight was about wellness, and health and wellness, and this is all about what health and wellness is. So, let's continue to have the hard conversations, but do it with the love, compassion, and those teachings that we have. We have so much knowledge and so much love, and we're going to get there, and we're going to get there together. And these are the discussions that are hard. And tonight, when we go home, we will be praying, and we'll be asking for forgiveness if we've harmed or hurt anybody with our words, but also we'll be thankful and have that gratitude in what we've learned together and how we're going to move forward. So to end off our evening, we're going to, of course, give out one more comment.
Yeah, it is.
Okay.
Talking about reconnecting again, and I noticed we have some new people here. If you don't already know, the new health person here is related to Flemont from across, the family of Flemont from across who used to be here. And Josephine was, I think that was the name of one, Joe Flemont, okay. Yeah. And then the other lady back there, she's one of our Gaddy ladies. Their family was Barbara Gaddy and Flora Holt. They lived down east somewhere, and we met them before. They came out here and they looked at the old Gaddy farmstead over by Redwoods that way. Anyway, this one is Krista. She says, for those who are urban and live far away from our reserve, And how are we taught traditional ceremonies and partake? And she says a lot of teaching, but myself and my son, I would want to, both of us to start connecting. So that's what we're doing. We're bringing everybody back. So anyway, that'll be the last comment. Debbie?
Exactly. And, you know, that's part of our DNA roadmap when we go out to the big cities is the DNA roadmap as well as our family and our community and our nation's history. And we talk about the Meopamatsuan Center. We're planning on there to be an entire room dedicated to our history and our lineages, where anyone at any time will be able to access what the lineage is, and anyone could come home. We're hoping to have it eventually online, but it was, you know, the stuff that Dean does, and I acknowledge all of the hard work that Dean Lara has done on our DNA roadmap and talking about Wakotoan is how amazing it is when we go into those areas where they may not have ever stepped foot, our members may have not stepped foot on our home reserve, but for them to stand and to see their mushims and their kokums on the wall, and Dean to be able to show them exactly where that is so amazing. And it's that first step to connection. So when we talk about those services, Councillor Curtis, we need to keep this on the radar is as we promote the committees in the different areas, that we are able to concentrate also on the ability to access cultural and spiritual services as well. So thank you for that online.
Okay, that's good.